Hey everyone, this is Bruce the Boss Brooks coming at you today with a little something different than my normal content, so let's get started. So this video is actually going to be more of an educational piece because my expertise is that in healthcare insurance and more specifically Medicare and how it works. But before we get started, as always, if you like this, please don't forget to hit the like button and also please subscribe. And if you have any questions, I want to encourage you to leave a comment in the comment section. And if you just have any general comments, I love your feedback. Put that in the comment section as well. But if you have any additional questions to what I'm going to put out in this video, please add those questions in the comment section. I'll be more than glad to address them either directly in a follow-up comment or a reply comment or in a follow-up video. So let's go. So many of you have probably already have gotten this booklet in the mail. So whether you are on Medicare already right now, just beginning with Medicare and have a lot of questions, even if you're not on Medicare, but you have parents who are Medicare eligible and you want to help them through this difficult and challenging process that's about to take place very soon in terms of open enrollment and plan changes. This will be helpful for you if it's your grandparents who are on Medicare and you are trying to step up because you want to help them, because there are a lot of questions as it pertains to Medicare that our elderly people have, and the more information you have, the better it can to, again, either help you if you yourself are on Medicare, if it's your parents that you're trying to help out, or your grandparents, because we do get a lot of calls. And when I say we, a little background, yes, I am just starting to do some YouTube videos now, starting this channel, but a little background on myself. I have been working in a major healthcare insurance for the last 10 years. And of those 10 years, I spent a little over 4.5 of those years from 2012 to 2017. Well, start of 2017 in the Medicare division. So Medicare, and I still work with a lot of and I'm still with that company, and I still work with some Medicare plans or plans that are comparable to Medicare. And so Medicare is my expertise. So I wanted to do a video to help out during this period. So what I'm going to do is I'm going to do a series of videos on Medicare. I can't do it all in one video because it's just too much information and it'll be too long of a video to ask anyone to sit through. So I'm going to try to chop it up in multiple videos. So this right here is going to just be an introduction to Medicare, an overview or high-level overview of Medicare. But don't worry, I will get into even greater details on how the Medicare plans work, the different benefits, costs. I'll break those down in greater details in later videos. And if you want to see those, please, again, don't forget to hit the like button and or put in comments to let me know if you want more. And if so, specifically what, so I can address that in that future video. All right, so let's get started. So like I said, a lot of you have gotten this booklet here. It's called the Medicare and You booklet. All right, why are you getting that? The reason you're getting that is because we are about to enter into the Medicare open enrollment season. This is the time in which you can make changes to your Medicare plan for the upcoming year. I'll get into greater detail about the different election periods for Medicare in another video because, again, don't want to spend too much time in this one video. This is just an overview. But right now, we're about to enter into the main enrollment season for Medicare, known as open enrollment. Open enrollment lasts from October the 15th through December the 7th of pretty much every year. If that does change, I will put that in the video for an upcoming year. But for the last, I'd say, and it was a different date back in 2010 and prior, but for the last 10 years, the open enrollment season has been from February the 15th through December the 7th in order to make any plan changes for the upcoming year. And so you're getting this Medicare and You booklet in order to help prepare you, like, okay, this is what you can be expecting. These are the different types of Medicare plan. So you'll be getting those booklets either in the coming weeks, if you haven't gotten them already. Otherwise, you should have gotten your booklet by now, as well as material from whatever health insurance provider you get it through. So again, just a reminder, here are the open enrollment dates for Medicare. So quick high-level overview. So what is Medicare? Medicare is a national health insurance plan or program in the United States that was started back in 1966 under the Social Security Administration, but is now run by the Centers for Medicare and Medicaid Services, known as CMS. You'll hear that name quite a bit throughout the whole Medicare experience, CMS. And it primarily provides health insurance to the following, and I'll get into greater detail of who is eligible for Medicare in a later video, but just high-level overview of who is eligible for Medicare is the primary target and their demographic are those who are 65 years and older. If you have a disability, so even if you're young, in your 20s, 30s, whatever, but if you have a debilitating disability, you qualify for Medicare, and also those who have end-stage renal disease, or also known as ESRD. Now, Medicare is broken up into 4 different parts of Medicare. Now, again, I'm going to go into greater detail in a later video. If you have any additional questions, feel free to put them in the comment section below. But here are the 4 parts of Medicare. So you have Part A coverage. Part A covers inpatient hospital stays. So if you're going into the hospital to stay overnight, to be admitted, skilled nursing facility, as well as hospice care. So that's Part A, which you are eligible for if you, again, meet the criteria that I mentioned earlier regarding being eligible for Medicare: age and disability, end-stage renal disease. And so long as you work for 10 years of your life, or 10, if you worked for 10 years or 40 quarters, you qualify for Medicare Part A for free. There's no monthly premium. Then you have Medicare Part B. Medicare Part B covers your basic medical services or your general medical services. So even for the young people, you may be more familiar with these. So your basic doctor office visits, whether you're talking about your primary care doctor, specialist like a cardiologist, ophthalmologist, optometrist. So it covers basic office visit. It covers surgeries, outpatient surgical procedures, medical equipment like crutches, wheelchairs, if medically necessary. So that's your Part B services. So both Part A and Part B can be covered under the Social Security Administration, or just say CMS, and that is known as Original Medicare. So you can get your Part A and Part B through CMS, also known as Original Medicare. Now, unlike Part A, which can be free so long as you worked for 10 years or 40 quarters, Part B does come with a monthly premium that you have to pay, and it can come out of your Social Security check, or you can work out another form of payment with Social Security paying for Part B. And if I'm not mistaken, right now for 2020 or upcoming, for 2020, the monthly premium for Part B, if you make anywhere under 80, now the premiums do range. I'll get into that in greater detail in another video. But if you're making under $87,000 a year, or reported under $87,000 in your 2018 tax return, it's going to cost you roughly about $140 a month. That price varies depending on, and will increase if you make anything more than that. I'll go into greater detail in a later video. So again, Part A and Part B are all covered under what's known as Original Medicare. That's the federal government agency. However, you can get additional Medicare coverage through a private healthcare insurance like any one of these. So you can get additional Medicare coverage through what is called a Medicare Advantage plan. They also call a Medicare Replacement Plan, and you can get it through private health insurance companies such as Blue Cross Blue Shield, Aetna, Cigna, Humana, to name a few. But why would someone want additional Medicare coverage in addition to what CMS provides? It's because a couple of things. For one thing, Original Medicare under just Part A and Part B does not cover everything. It does not cover even some of the most basic services you would think that are essential to the target demographics. It does not cover most dental services. It does not cover eyeglasses or eye exams for prescription eyeglasses. It does not cover hearing aids. It does not cover routine foot care. A lot of those are what you would think are essential services to people over the age of 65. Hearing aids, glasses. I mean, come on, that's just common, but it doesn't cover most dental services or dentures. Again, talking about an aging population losing their teeth. So that's where Part C coverage comes into play. If you do get a Medicare Advantage plan, it does replace original Medicare. So CMS no longer covers or pays for those services. It's all paid for through that private insurance company. So there'll be no more need for you to call Social Security or CMS. You can call whoever your private health insurance provider is to get questions about your health care plan. So that's Part C. Part C does cover everything I mentioned under Part A and Part B. So a Part C plan will include your inpatient hospital stays, skilled nursing benefits, your doctor's office visits, whether it be to your PCP or specialist. Your Part C plans cover those things I mentioned that original Medicare does not cover. So a Part C plan will cover or can cover most dental services. It'll cover prescription eyeglasses, dentures, routine foot care. It'll cover hearing aids. So that's why people get a Medicare Advantage plan. I'll go into greater detail in a later video on the intricacies of what is covered under Part A, Part B, Part C, but that's just a basic overview. And then you have Part D insurance. Part D is your prescription drugs. And you can also get a prescription drug plan outside of CMS through a private insurance company. So as I mentioned earlier in the video, we are about to enter into the open enrollment period beginning October the 15th through December the 7th. So you're about to see a plethora of commercials targeting Medicare members. You're about to get a plethora of materials, whether it be the Medicare and You booklet from original Medicare, talking about any changes to Medicare coverage this year, as well as any material from your private healthcare insurance. So basically what that means is if you are interested in making any changes to the Medicare plan that you currently have, if you do seek a Part C plan, that is, if you're fine with your Part A and Part B as is and you don't want Part C, you don't have to do anything. But if you are interested in getting additional coverage, or if you already have a Part C plan, but you want to maybe consider looking at other plans or look to see what changes your current plan is about to make for the upcoming year, this is your chance to look at all of those different plan options as well as the plan changes to your current plan and make changes. And you can, again, make those changes anywhere between October the 15th and December the 7th. And those plan changes, if you do decide to make a plan change, will take effect January the 1st, 2021. So you'll be able to keep your current plan and ride that out for the remainder of the year. So let's say if you currently have a plan through a Medicare Advantage plan through Blue Cross Blue Shield, you can look to make a plan change, whether it be through another plan through Blue Cross Blue Shield, or you can switch companies altogether to Humana or choose an Aetna plan. But that plan change will not take effect until, again, January the 1st of 2021. But you have until October the 5th, from October the 15th through December the 7th to make those changes. So if you are new to Medicare for the first time, if it just so happens that you are turning 65 either this month, next month, November, and so 2021 will be the first year you've actually fully had insurance Medicare coverage, you can get that Medicare coverage, or if you have additional questions, you can call CMS at 1-800-MEDICARE. That is 1-800-633-4227. Again, call 1-800-MEDICARE at 800-633-4227. Or if you are interested in a commercial plan through Aetna, Blue Cross Blue Shield, Cigna, Humana, whatever the case may be, through a private insurance, feel free to call those companies, their customer service line. You can look that up online, but I'll try to provide even greater details in a later video. If you have questions about those insurance plans through the private insurance carriers. All right, so that's all I have right now for Medicare, just the basics. Again, you have plenty of time. So today's date is September the 12th, 2020. So you essentially have another 30 days before the open enrollment period begins. Take this time to look at the literature you're about to receive in the mail to see what options you like so that you can begin considering that process. Again, so if you have any additional questions, feel free to leave those questions in the comment section below. I'll be more than glad to reply to them and or do another video specifically tailored to the questions you provide below. But I will do additional videos breaking down even further the parts of Medicare, the cost of Medicare, the different types of Medicare plans, talking about the differences between an HMO versus a PPO. Do I require a referral? Do I need an authorization? What's covered under Medicare Part A and Part B? What's covered under Medicare Part C? Why do I want a Part C plan? More about things like the late enrollment period penalty, as well as the additional ways that you can get additional financial help for paying for your Medicare or medical costs. I'll be more than glad to go into those in greater details in later videos in the coming weeks. But again, leave any additional comments or questions in the comment section. And if you like this information, please feel free to like and or subscribe. And in addition to my commentary or content that I provide on news and information going around the world, I'd be more than glad to also use my expertise in the field of Medicare and healthcare insurance to answer any questions during this difficult time, because I used to work I used to work specifically in Medicare. I still work for that company and I do work on Medicare plans, but I know all about the call center side of my company and all of the calls that do come in. It's a lot, it's very confusing, and I'll be more than glad to use my expertise to help you out in this confusing period. All right, so until next time, y'all have a great day, and y'all shall see me later. Peace.